On the 6th of June 2018, 18 members of the public from in and around Brighton gathered together at the Juries Inn on Brighton waterfront for a citizens' jury to discuss the question of whether researchers should have access to the free text data in patients' medical records.
So a citizens' jury is a method where we bring together a cross-section of the public to consider a public policy question, and in this case our question was around using free text health data for research and other uses. It's a good approach in this particular case because whether or not we should use free text health data for research is a complicated question. There's quite a lot to know, and in 3 days people can think about the topic, deliberate amongst themselves, learn from the expert witnesses and reach considered conclusions. And this is the first time, in fact, that there's been any public attitudes research at all on free text health data and its uses.
So free text contains a lot of sensitive information, and that's why it is very important that we follow the right data security and governance structures before we make the documents available for researchers.
It's really important to engage the public about using their health data. It's data that's collected about them, so they have the right to be involved and asked about decisions and how their data is used. The NHS data is a valuable resource, but it should be there to benefit everyone, most of all the public. And over and above that, it's just the right thing to do.
The whole process was fair, it seemed to be impartial, it seemed to be confidential and very informative, and I really liked the process because it got me thinking, and I thought, yeah, I'm a citizen, I do have a brain sometimes and it needs to be tapped for what I think, because I'd never get asked to focus groups or anything like that, so it was really nice to be able to use my brain and offer something to make decisions about the future of our health service.
So at the end of the jury, the jurors indicated that they were all either very supportive or fairly supportive of sharing free text, giving access to researchers for free text in patients' medical records. But their support wasn't unmitigated. They had several concerns about privacy risks. They felt that patients should have the possibility of opting out of such data sharing. And for that opt-out to be meaningful, they needed full transparency around what their data was going to be used for, who was going to use it and for what purpose. So they were able to articulate for us some very helpful suggestions for mitigating their concerns, including the idea that we should continue to develop technological solutions that would help to protect their privacy when their data is shared. This jury's event will be important for future research because we need a better national framework that governs how free text from patients' medical records can be shared for research. At the moment, data isn't being shared for research, this particular type of data, and so we might be missing out on a valuable resource that could inform us of new treatments or new developments in medical research and save patients' lives.